A public health physician, Dr. Oladapo Asiyanbi, joins us live via Skype for more on the Delta variant detected in Nigeria. Good to have you join us, Dr. Asiyanbi.
Good afternoon, viewers. Good to be here too. I'm glad to be here.
So we have not been recording a lot of cases in recent times, especially except for Wednesday, where we recorded about 100 cases. But there has been news of this Delta variant, all around the world, especially in countries like India and the UK. Talk to us about how you feel now that we have recorded a case, because one would have thought that the federal government was doing everything to ensure that we do not have this kind of situation.
Thank you very much. Well, the federal government and all the responding subnational government have been doing all they can. However, you can only respond to what you know. So, first, likelihood of importation has shown that this has been picked up from travelers. And the reason is very clear. Many more people are traveling during summer, inwards and outwards. So we expect many more travelers to get tested as part of the requirement. So we're likely going to see more testing in this summer months from travelers, And so the chances of picking up the Delta variant will be more. So imagine if 50 people were traveling compared to when 500 people were traveling. The chances of getting infected will be more. The chance of bringing it into the country will be more. And it's likely it may have been there, because I do not think that the NCDC is testing every sample for the type of strain. But they would have done random checks, and from those random checks, this has been picked up. So that is a good news, at least, to be able to know how well that spread is going. That is imported spread. However, in country, so people who have had the Delta variant and may have escaped scrutiny, maybe the strain was not checked. You only just wanted to know if the person was positive or not. Then you wouldn't know. And the behavior of this strain from countries who have had it has shown that it spreads faster, is likely to cause more severe disease. And some have said that it may not be as potent, or it might not be as responsive to vaccination. However, the jury is still out on that.
That's exactly where I was going to go next, because right now, when you look at the number of cases that we have recorded so far, it's just about a little over 168,000. We have those who have recovered 164,000, and then about 2,112 deaths. So in the coming days, how do you see this new variant impacting on our figures?
Okay, well, if the more tests we do, the higher the likelihood that we will know the real amount of the disease we are dealing with. So in the past 6 months, the testing levels have gone down because people feel COVID has gone, and therefore you really not know. So including discovering the Delta variant, it is by testing that you will know that. So if nobody tests, then you would not know. Now, what is this telling us? We hope this is not the beginning of a new wave. We really hope so. However, if it is, then we'll be looking at, because usually the increase up to a spike for us to say there's a new wave occurs between 6 weeks to 8 weeks from the time it starts rising. So by the time we look at the graph of the spread of the disease, within 6 to 8 weeks of that, if we don't get enough spike, then we don't have a new wave. However, if we do, then we're in for an unpleasant time. And so my advice for Nigerians is, we shouldn't just think about the Delta variant, just think about COVID, that it is still being there. we should kindly go back to what we were doing about a year ago. Still maintain the social distance, still wash our hands, use our face mask, reduce gathering to the level that government said we should. Now, also, let's add two things. Let's go back to routine testing. People should come back and get tested. And more importantly, when vaccines are available, people should please make themselves available to be vaccinated.
Absolutely. It's time for everyone for those who have dropped their mask, it's time for everyone to begin to mask up all over again, especially now that we have a new variant. Public health physician, Dr. Oladapo Asiyanbi, thanks for talking to us.
You're welcome. My pleasure.